Hello guys, I am Eric Khan Baloch. I am first year student of Bachelor of Physiotherapy at Marwadi University. My today's topic is observation and experimentation in physiotherapy and subject is psychology. Hello everyone. Today I will discussing observation and experimentation in physiotherapy. Two core methods that help physiotherapists and understand patient condition and improve treatment effectiveness. Physiotherapy is a science-based profession that focused on restoring movement and function. To do this effectively, physiotherapists rely on both observation and experimentation, not just to treat but understand why a patient is moving certain way to responding a treatment. What is observation in physiotherapy? Observation in physiotherapy means carefully watching a patient's movement, posture, gait, or muscle function without interfering. It begins the movements the patient walks in, how they sit and stand or walk, gives valuable clinical clues. Observation is especially important during assessment and early stages of rehabilitation. Now types of observation. It was visual observation, watching how the patient moves or behave during exercise. Palpation based observation, feeling for muscle tone, joint movement and swelling. Functional observation, assessing performance during a task like climbing stairs or lifting an object. All these types help identify, implement and guide treatment plans. Now we can go for the strength and limitations of observation. Strengths: non-invasive and easy perform, gives a natural picture of patient condition, helps build a clinical baseline. Limitations: it is objective. Different therapists may interrupt differently, can miss internal issues not visible externally, cannot determine the exact causes of dysfunction. What is experimentation in physiotherapy? Experimentation involves testing the effect of specific exercise, treatment, or therapy on a patient's performance. For example, a physiotherapist might apply electrotherapy or new exercise protocol and measure whether it improves range of motion or reduce pain. This helps verifying that actually works for a patient or group. Clinical trials and experiment in physiotherapy in research setting. An experiment involves independent variables. Example like types of treatment depends on variable. Example, it is pain score, strength and mobility. Control versus experiment group. Standardized measure like goniometer, strength test and questionnaires. Their experiment help create evidence based protocols for physiotherapy. Real life applications. Observation helps identify poor posture, abnormal gait and muscle imbalance. Experimentation for test if TENS therapy reduce pain or if stretching improve flexibility. Both are equally essential. One guides day-to-day assessment and the other back it with scientific evidence. Conclusion: in physiotherapy, observation gives us insight into the what, and experimentation helps understand the why and how. Together, they form the foundation of clinical reasoning and evidence-based treatment. A skilled physiotherapist use both observing the body and experiment with the care. Thank you.